Good morning, everyone, and welcome to Health and Social Services for December 7th. And can I have call of the roll? Perfect. Thank you very much. Is there any declarations of pecuniary interest from members of committee? Seeing none, hearing none. We're going to move forward to the adoption of the minutes from October 5th. Can I have a mover? Councillor Anderson, seconded. Councillor Mayor Foster. Any questions from the minutes? Seeing none, any opposed to the minutes? We have no statutory public meetings, and I'm going to turn over to the Commissioner to give introduction to our first presentation of 5.1.
Thank you, Madam Chair. Good morning, members of Health and Social Services. I'd like to introduce you to Julie Gaskin, our Director of Children's Services from our department. Today, we are pleased to present to you the 5-year Early Learning and Childcare Service Plan for Durham Region. Along with an outline of our key priorities, Julie will give an overview of the new Canada-wide Early Learning and Childcare System and our directed growth strategy for childcare in Durham Region. The new Canada-wide Early Learning and Childcare System, or CWELC, as it is known, is the driving force for childcare in Ontario, and expansion of childcare will be done within the context of CWELC. So these three things together, the service plan, CWELC, and our expansion plan, will guide the work of the Children's Services Division in the coming years. You've been provided with a copy of the service plan and the directed growth strategy as attachment 1 of Council Report 2023-SS-14. Now I will turn it over to Julie to take us through the presentation.
Thank you very much. I'm sorry, I've been doing a lot of presentations this week, so my voice seems to be showing it. Thank you for letting me share this with you today. The Children's Services Division performs the duties as the Consolidated Municipal Service Manager for Early Learning and Childcare in Durham. As such, some of our key responsibilities are planning and funding for licensed childcare, planning and funding for early on child and family centres, and supports for special needs children in childcare. We're also responsible for the Canada-wide Early Learning and Childcare, or CWELC, system implementation and oversight, for the funding allocations, reconciliations, and analysis of operator budgets. There's a lot of work that goes into rolling that system out. We're also responsible for childcare contract compliance and quality assurance, and funding to support families who require fee subsidy. The need for fee subsidy funding is crucial for families now and into the future of childcare, even after CWELC is fully implemented. This work is completed by ensuring we plan early years and childcare programs that meet the needs of children and families across Durham Region. Our 5-year service plan was developed to support these CMSM responsibilities. It was developed using local service data and in consultation with families, the early learning and childcare community, and other agencies who support children and families. The information gathered identified 4 key priorities that will help us continue building a high-quality childcare system. Priority 1 is to support expansion and access to childcare. We'll do that by strengthening the CWELC system and expanding within our directed growth plan, allowing us to fund childcare where we need it the most. And I'll discuss more details about that later. Priority 2 is to enhance supportive and inclusive childcare. And one of the ways we will do this is to expand mental health and well-being supports for childcare workers and educators so that they can do the important work of supporting the children and family in our region. Third priority is to increase, attract, and retain quality registered early childhood educators. One of the ways that we will do this is by supporting different pathways to becoming an RACE. This is work that we recently started in partnership with Durham College so that we can graduate more ECEs to support our growing and critically understaffed sector. And finally, our 4th priority is to continue to optimize virtual service delivery and technology. This is where we leverage technology to promote communication and collaboration in the sector and with families. These are only some of the key actions outlined in our Early Learning and Childcare Service Plan. The plan has been developed to support our division's commitment to expanding a coordinated and responsive early learning and childcare system that supports Durham Region children and families in reaching their best potential. The plan aligns with the Ministry of Education's priority to create a system that is high quality, accessible, affordable, flexible, and inclusive. And it also aligns with the current regional strategic plan to support community vitality, social investment, and to provide service excellence. The plan was developed allowing for flexibility so we can respond to the changes that we know are coming in the future. Some of the priority and action items have been brought forward from our previous service plan, and these reflect the continued work to build our evolving system. Additionally, our division has begun work on all 4 of these priority areas with the introduction of the Canada-wide Early Learning and Childcare System, and additional actions and activities will be set as activities evolve. So now I would like to shift the focus to the key driver of our service plan, which is the Canada-wide Early Learning and Childcare System. This is otherwise known as CWELC, or most families refer to it as $10 a day childcare. As a service system manager, our work is changing in response to this. This really is huge for all of Canada and Durham as a whole. As the service system manager, our work is changing in response to it, and our service plan was created with this in mind. With CWELC as the primary guideline driving our work, I'll take a few minutes to outline it and talk about how we plan to grow childcare in Durham. Our region continues to grow at a significant rate. As our division developed the service plan, we focused on how to respond to the rapid growth and ensure families have access to affordable, reliable, quality childcare no matter where they live in Durham. The Canada-wide Early Learning and Childcare System was rolled out in a 5-year cycle. It was introduced with our division leading the implementation for Durham. CWELC serves to change how licensed childcare is funded with the result of higher wages for educators and lower fees for families. The CWELC system implementation has created tremendous opportunities for our families and for childcare operators. It will serve to support all families to pay for childcare and allow our much-needed fee subsidy program to support those families who need additional financial support beyond CWELC. The CWELC system is federally funded by the federal government and implemented by CMSMs on behalf of the province. It was introduced in March of 2022, and through gradual implementation, fees charged to families have been cut by 52.75%, then will be reduced to an average of $10 a day by 2026. At this point in Durham Region, with funding, increased wages, and funding 52.75% fee reduction, our CWELC budget alone is over $100 million, just for Durham. To support families who find $10 a day a hardship, we can continue to serve more families through our fee subsidy program, ensuring no family finds the cost of care a barrier to access. CWELC has increased salaries as well for early childhood educators, and this ensures new space and ensures new spaces align with our growth plan for childcare, which is included in our service plan, and I'll touch on more in a few moments. You may have read in the papers a recent announcement where the wage floor for early childhood educators will be $23.86 an hour beginning in 2024. This is an increase from the previous announcement of it was supposed to be $20 an hour as of 2024. So the provincial government is seeing the value of increased wages for early childhood educators and responding to this. CWELC was introduced in 2022. At that time, all licensed childcare operators could choose to opt in and would be eligible if they could prove financial viability and accountability. 2022 was known as the open enrollment phase. 89% of our childcare operators opted in at that time. In 2023, open enrollment closed, we've now moved to directed growth to match pace with the slow rollout of funding for CWELC. This directed growth will take us to 2026 until we get to $10 a day. So directed growth means only licensed childcare that aligns with our directed growth plan for Durham are eligible to receive CWELC funding, and they still need to prove financial viability and accountability. Children are eligible under CWELC if they attend a childcare center that's enrolled and they are under the age of 6. So CWELC does not fund school-age programs. Childcare centers who participate in CWELC receive funds to lower fees for families and increase wages for educators. As counselors, you may be receiving calls from constituents, and I know some of you have because they've been passed along to me for response. And those constituents who are childcare licensees hoping to be enrolled in CWELC. The Ministry of Education stipulates that childcare centers as independent business owners must meet specific criteria to be eligible to enroll in CWELC. With directed growth and limited CWELC growth spaces, eligibility does not always mean successful enrollment. This is where our growth plan comes in, and again, I'll touch more on that in a moment. To be able to submit an application for CWELC enrollment, childcare business owners must be sure that they're located in a priority neighborhood, that they demonstrate financial viability, that they meet our contractual obligations, and they use funds for intended purposes and submit audited financial statements and budgets to us annually. As the CMSM, it is then our responsibility to support expansion that maintains at least a 70% or greater not-for-profit auspice ratio for spaces. This is the current ratio for childcare spaces in Durham Region. We also must approve new spaces within our annual space targets and maintain service agreements with CWELC operators. We ensure contract compliance through audits, site visits, and data collection, and we do provide training and education and guidance to operators to support compliance. We need their spaces. We want them in our system, so we want to support them. This is outlined in our growth plan for childcare, which is part of our service plan. The growth plan is an appendix to our service plan and will be updated annually, and it will be shared publicly once it's approved by council and will be updated annually as data progresses. So on to the directed growth plan for Durham. Now, as the last part, I'm gonna share with this is our plan for Durham. The directed growth plan will impact only the new CWELC approved spaces in Durham. New licensed childcare centers can still continue to operate outside of this plan, but they will operate without CWELC funding, and so they'll set their own rates and charge families full fees, and educators will not receive the additional wages. The growth plan was created using detailed community analysis using local data. We will update that annually, as I mentioned, to ensure that our directed growth plan contains the most up-to-date data that reflects the actual growth and emerging trends in childcare. Our growth plan ensures new spaces will go into communities across Durham where they're needed the most. The growth plan in the attachment in your package, begins on page 51. I want to share with you the growth targets. These targets were mandated by the Ministry of Education for our region. I have put in a request for additional spaces with the Ministry of Education, received approval to move some of my spaces forward and change from school-based to community-based, and I'm still working with the ministry to obtain additional expansion spaces. So as I mentioned earlier, spaces will expand using this targeted growth. To do this, the Ministry of Education gave all municipalities across the province targets to meet. These targets are matched with the funding that we receive annually, increasing year by year. The chart illustrates the total number of spaces we're funded to expand by year and by location. So you can see if my little laser pointer will work. I can't find it, Roger. It's not working. That's okay. Whoop. The chart, on the chart to the left, under total spaces, you can see the total is 2,029 spaces for all 5 years of the CWILC rollout. Those spaces are split between community-based spaces, and those are childcare centers that operate in school buildings, and community-based spaces, and those are childcare operators that operate in locations out in the community, not in schools. Between 2022 and 2026, we will receive those 2029, and as I said, I've asked for additional spaces. So 11,003 are in childcare, 926 are in community, 1,103 are in school buildings, and 926 are in community buildings. Our directed growth strategy must use these targets to grow, to guide how many spaces we can improve to ensure that we receive adequate funding. In 2022 and 2023, we successfully expanded by the 907 spaces allocated for these 2 years. And as I mentioned, I was able to move some spaces from school-based into community-based where we needed them. For 2024, we only have 106 community-based spaces. And interest from operators wishing to expand far outpaces that number. So we have continued to work with the ministry for additional spaces. So for context, 106 spaces is equivalent to approximately 2 childcare centers. So you can see why we need more spaces. The school-based expansion spaces are approved by us in cooperation with school boards. This is a process that's been ongoing for a number of years, so it's not new to us this year. Our local school boards then apply to the Ministry of Education for capital funding to build and expand childcare spaces in their school buildings. So with these targets in mind, how did we determine these highest priority neighborhoods? We gathered local data to inform our in-depth community analysis process. We looked at the capacities of childcare centers that we already have. We ruled out neighborhoods that had low vacancy rates, meaning they were already well-served and had spaces available. We looked at where we have already approved new childcare centers for future years. We reviewed census data to examine socio-demographic variables. We analyzed data gathered in response to supporting children with special needs in childcare. We looked at our early development instrument, or EDI data, to determine neighborhoods where children are vulnerable. And we also looked at where new housing is occurring to see where families will be living in future years. All that analysis was divided using our health neighborhood boundaries. This is how we've always gathered our data, including the EDI data. So for continuity, we've continued with that process. Here are the results of the highest priority neighborhoods in Durham. More details, specific priority neighborhoods, are listed in our directed growth report. Each lower tier municipality has priority neighborhoods identified, either this year or last year, like this current year or in future years. This is not to say that these are the only areas of need for childcare, and that's important to understand. We have a lot of areas of need for childcare across our region. However, with limited spaces, these are the areas that are most in need, so have been prioritized in our current plan. As new spaces open, and if our request for more expansion targets is approved, these neighborhoods will be adjusted. As we look toward achieving our priorities outlined in the service plan, we are ever mindful of events that may impact the service plan implementation and require a proactive response from our division. These things will include a new childcare funding formula to be announced by the Ministry of Education later in 2024. We've been given an allocation to begin 2024, and it will all be readjusted with a brand new funding formula, which really will totally change how we do our business mid-year. We have limited opportunity for capital funds to invest in the building of new spaces. As I mentioned, school-based spaces can apply to the Ministry of Education for capital. However, community spaces can receive some funding through grants provided by the ministry through us, but they're not intended to support the entire project. And nonprofit operators, we need to maintain our auspice of nonprofit operators, which is proving somewhat difficult since only commercial operators tend to come forward wanting to expand at this point due to that lack of capital. Federal, provincial, and municipal elections will occur during the lifetime of our service plan as well. And the end of the phase 1 of CWILC implementation will occur during the lifetime of our service plan. So we are planning for the future, and we've left our service plan in a position where we can be nimble and move where we need to go. And the announcement of the modernization of provincial software systems will also impact how we gather data, and that may impact the data we can use going forward in a good way, I hope. In conclusion, this plan is meant to be flexible, allowing for changes to priorities or timelines depending on the complex needs of children, family, and childcare operators in the early learning and childcare workforce in Durham. The CSD strives to provide children and families with high-quality early learning and childcare programs that meet the individual needs of families while recognizing and honoring the diversity in our community. Our service plan will strengthen the CSD's role as the municipal service manager to ensure an early learning and childcare system that is affordable, accessible, high quality, and responsive to the dynamic needs of our growing community. That's all. Thank you.
Yeah, thank you very much, Julie, for the presentation and for the information that you shared with us. Is there any questions to the presentation? Mayor Foster. Want to press your button? There you go.
So, Madam Chair, did you want to speak to the report as well as the presentation, or would you rather?
We can pull it up if that's helpful. Yeah,
So,
absolutely. Let's pull it
give me a
forward.
motion to alter the agenda to deal with 5 point, where are we at? 5.1.
And with the report, it is, yeah, 5.1. And any questions? Well, actually, let's say, any opposed to you altering the agenda? Seconder? Chair Henry? A little discombobulated. Any questions, Mayor Foster?
Well, early in the morning and snowing, and I would complain that Chair Henry is making faces at me, Mom. Julie, just an incredible amount of time and effort went in the report. And I was thinking about how I would phrase this. I'm worried that, I always say but. I bring it forward and try to and I'm hoping that I don't get a new nickname. It would be, Adrian Butt Foster. And I'm really hoping there aren't two T's in that butt. I'm curious as to who the intended audience for the report is. There's a huge amount of information in that. It has to be vague, as you point out, because of the nature of changes and uncertainty in the future. But I am curious as to who would take this, read this, and be able to use it in a practical fashion.
We're required to have this plan by the Ministry of Education through the Child Care and Early Years Act to support our role as the CMSM. So it does guide the work, even though, as you say, it is kind of vague. We do have priority and action items within it, and we trickle those down and work with our community to implement them. So the plan is pretty broad-based and high level, but there are action items that fall within those.
So I think it was page 31. It starts with
Yes.
the action items, which again are necessarily vague. So I anticipated that answer, and it's actually in the report that we need to report to the province. Are we spending more time than we need to? So frequently those reports are sort of a check the box, and I'm just very concerned that you and your staff are putting a huge amount of excellent time and effort. I mean, this document is polished. It's it's all things good. But is the ministry expecting this? Because surely they could make it easier. And I okay, you laughed. Okay, I recognize I'm speaking about the province here. So that's a valid reaction.
We do use this guide, and we've done it every 5 years, and we do use it as a guide. Believe it or not, I know it is big. There is a lot to it, but we do use it as a guide. There's an executive summary, and we typically take that executive summary and some of the key points out of the priorities and make a little tighter report to share with the childcare community. We work really closely with the entire childcare community to implement this. It isn't just us. We work in partnership. So we do shrink it down a bit to have it. I recognize actually the year before our last plan I think was 70 odd pages. So this one has our growth plan in it too. That growth plan is very detailed, and that was required by the Ministry of Education very specifically that we need to post publicly what our priority neighborhoods are. So that one's going to get updated annually, shared with people who are potential operators, and that is really our guidepost to future operators coming into Durham. The plan itself is smaller, and we do shrink it down a little bit further to be able to implement.
So great, that great answer, and it's evident that you're dealing with directly with the providers. I'm not singling you out. You would want to hear the discussion and dialogue I have with my director of planning. I will probably get in trouble for staff listening to this meeting from Clarington, but thank you for that, Madam Chair. Thank you.
Thank you, Mayor Foster. Would we expect any different for you to get in trouble? Is there any further questions? I have some questions in that in your presentation you spoke about the funding formula and the potential change that could come mid-year. Is there any concerns? Well, obviously there's concerns because midstream changes don't necessarily help and give that security of what your potential is for your moving forward. Is there any indicators what that future funding could look like?
There is a technical table, and there are 6 municipalities that are asked to that table, of which, and we are one of them. So we're fortunate to have, and I took over from Lisa McIntosh, who was the previous director for CSD, and so she had a table, and I was able to keep that position, which is real value added because we have a say. Well, we have input over what's happening into the future. One of the things that's happened with our 2024 funding coming in this year is that there were announced administrative funding cuts and cost shares that were announced in 2018 to be implemented in 2019. They were announced in 2019, and they ended up being delayed because of the pandemic and now because of CWELC. But there was a statement that they were going to get rid of those cuts and cost shares. However, the new funding guidelines we got for 24 has our cost share significantly decreased. We used to have a 10% allowable admin. Now we have a 5% allowable admin, and there's a 50-50 cost share. So basically, we went from getting 10% funded to 2.5% funded because we have to cost share it. And there's other cost share pieces within that, which will have an impact on how we are able to support CWELC. We do have other funding for admin from our CWELC, but it's 2 separate budgets currently, which again adds for a lot of administrative burden on us managing those 2 streams. So the funding formula going forward, the new one coming out, we were supposed to have it for this year. It kept getting extended, but it was being extended because they were listening to what we were saying. It was very prescriptive, or seemed like it was going to be very prescriptive initially. We, as CMSMs, have been pushing back on that to say we have to have flexibility in if you give us individual little funding pots and I'm sending money back, but I don't have enough money over here. So we have pushed for that, and it appears that they're listening to that. Getting a new funding formula mid-year is a concern because there's a lot of work to do to start a year, and then we'll have to restart a year mid-year. We gather budgets from operators. We look at all of that money across the board. So there are definitely some concerns with a mid-year implementation, but it was preferable to getting it in December and having to roll it out in January.
And the funding you're talking about, I know that Councillor Crawford and myself, having come from the school board, and the discussion about the envelopes and how those envelopes and the inability of the transfer between the envelope is not conducive to helping for a budget to move forward.
Right.
One, in the education side of things, but now in our childcare side of things, that there needs to be more flexibility rather than having it tied into one envelope where there needs to be more. My second question is, we held a roundtable, and it was with our ministerial group, and the question was asked about how can we get more community-based spaces and partnerships. So how would one be identified to be a part of the community-based spaces for childcare?
The first is that it needs to be in one of the priority neighborhoods that we've indicated. There are wait lists across the region. We do have operators come to us and say, there's massive wait lists, we really need this here, and that may be the case, but the neighborhoods that we chose, the majority of them have, for instance, 0 infant spaces, licensed infant spaces, or some neighborhoods have 0 spaces altogether for 0 to 6 years. So those are the highest priority neighborhood. They would have to be in one of those priority neighborhoods first. They also, at this point, we really need nonprofits to come forward. We have across the region, if you include all school childcare as well as community-based and school-age childcare, we're about 60% commercial, nonprofit, 40% commercial. We're 70% CWELC, nonprofit, 30% commercial. How it's evolved in Durham, our school-based spaces are our nonprofits. Our community-based spaces, largely, about 90% of them are commercial. So the ones that want to expand in community are the commercial operators. To maintain that 70% auspice ratio, which is a requirement of the federal government, the plan is the Canada-wide plan, so the federal government is saying you have to keep that nonprofit. You can't go below 70% for a nonprofit. That's going to be the challenge. So we do get grant funding from the province to support some community-based capital projects, but it says it's not intended to support the whole project. It's minimal. And so we're going to have to look at ways to find other funding sources for capital grants to be able to build in the community, and that's one of the challenges that we're working on right now.
Okay, I appreciate that. I know Commissioner wants to say a few words as well.
Thank you, Madam Chair. Thank you, Julie. I just wanted to express the importance of this program. It is growing at a very fast pace, and by 2026, when we are at $10 a day, this budget and this responsibility, I will say, and I've heard, will be as big as the police, as Works is today. So I want us to, that's why it was so important, not only because we need your approval to approve the service plan, but second, I wanted to get everybody to understand what it is that this program means. And we all agree it's important for our economy, it's important for children. However, this is the piece that I really wanted you to understand. So there will be moments of advocacy where we will need your support moving forward, especially as we talk about the nonprofit and how we're going to support them with capital. Thank you.
I appreciate that. Thank you very much. And Julie, thank you for the presentation today.
Thank you.
Thank you. So members of council, this is 8.2B, and mover is Mayor Foster and Chair Henry. Any opposed to the report? Thank you. We're going to move forward to the next presentation. Alex Swirsky, epidemiologist, and Tara Supancic, Senior Environmental Health Specialist, Climate Change and Health Vulnerability Assessment. Good morning. I think your microphone is muted, Tara. You're still muted.
There should be a request to speak button that looks like a face with stuff coming out of it.
On your screen. There we go. I think you're on, Tara.
No, we
nope.
still can't hear you.
Still can't hear you.
Sometimes I find with the headphones it doesn't work. Maybe try unplugging your headphones.
No, it's still not working. Did you unplug them from your computer? We know. Can you press the button again? Okay, try it now. No, still can't hear you. Alex, are you able to do the presentation? We need to get you to press the button as well on the bottom of your screen. There you go.
Can you hear me?
Yes, we can hear you.
Okay. Just give me one.
What we could do, if you want, we can go to the next presentation and see if you can sort out.
That would be really appreciated.
Okay, all right. So we'll go to the next presentation, and I'm going to call upon
Thank you.
Lisa Kitchen. Alex, if you just want to, yeah, that's perfect. Lisa Kitchen, Director of Durham Ontario Health Team, and Dr. Peppy McTavish, the Durham Ontario Health Team Path Forward, Acceleration, and Key Priorities. Good morning.
Good morning. Pardon? Okay. Really mess with everybody. So good morning. I'm Peppy McTavish. I'm the Associate Medical Officer of Health for the Health Department. I think I've met everybody here before. So it's my pleasure to be here with Lisa Kitchen. So she's the Director of the Durham Ontario Health Team. You've probably heard a little bit about Ontario Health Teams. So we thought Lisa should come and tell us more about it. And I'm a part of this work as well on the Executive Committee. And if you've heard before about the Ontario Health Team locally, the Durham one, John Riches, who used to be one of our deputy chiefs for paramedicine, held this role on the executive team. And then when he left, unfortunately, I took over. So that's why I'm here.
Unfortunately.
So that's why I'm here with Lisa. So we're going to talk to you today for the next 10 minutes or so, and happy to answer any questions about the Durham Ontario Health Team and the path forward and what acceleration means, because that keeps coming up in the news, and then the key priorities locally. So over to Lisa, and we just, there.
Fantastic. Thanks, Dr. McTavish, for the introduction, and good morning, everyone. We're thrilled to be here to provide an overview on Ontario Health Teams, and specifically for Durham, what we're focused on in the immediate future. So just to provide a bit of context on a background for the concept of Ontario Health Teams. This was introduced by the ministry back in 2019, and really about a model of integrated care for how groups can come together and really work differently to ultimately provide a coordinated continuum of care to patients. And really recognizing that this may not even be from the same organization or even the same space, that we really wanted to see what we could do differently within a new model of care across the full continuum. And so at a minimum, OHTs have hospitals, home and community care, and primary care providers. And really the focus is on new models of care and integrating across the system. So within OHTs across the province, currently there are 57 approved OHTs, and the Durham Ontario Health Team was approved back in 2019, right before COVID, and we were fortunate to be part of the first cohort and part of the first initial 24 that were approved. Right now within the East region within Ontario Health, there are 12 OHTs, and the Durham OHT resides within the East region. This slide speaks to the vision for the Durham OHTs. So when we think about in the long term at the mature state for OHTs, Durham will provide the full continuum of health and social services to the entire population, and this is through the entire lifespan as well, from birth right through palliative care. In the immediate term, the Durham OHT had narrowed the field down to two key prioritization areas for two high-need areas. And this is with our older adults living with frailty, and then recognizing individuals living with complex conditions, with a subset on pediatric and youth, recognizing that we're very fortunate within the Durham region to have a children's treatment center with our partnership with Grandview. We also recognize that there is a need for mental health and addictions to play a really critical role, and so this work is interwoven across all of our priority areas of focus. And then also recognizing that primary care acts as a core enabler for our work, as well as our connection with home and community care support services. This slide highlights that we have 18 core formal signatory partners. So all of the partners that you see on this slide in early days, without really knowing what is an OHT, what is the concept, wanted to put their hand up, took a risk, and put some skin in the game to say, I want to be a part of this. I want to build this together. And so you'll see here that we have highlighted that the region of Durham has been a core partner since the very beginning, and we're very thankful to have that leadership and that participation to the contribution for the Durham OHT. So here speaks to our overall purpose and where the Durham OHT and OHTs more broadly came to be from the People's Healthcare Act back in 2019. And fast forward to our immediate work, just earlier this fall in September, the Durham OHT was very proud to be announced as one of the initial 12 OHTs that has been selected for acceleration. And so we are now working even at a faster pace rapidly towards becoming designated. And what that means is that we will become a not-for-profit corporation. And so as part of our acceleration work, we have been tasked with new additional deliverables that we are excited to move forward with. The first being establishing a primary care network. And it's no surprise you see in the news that Durham region has a very high rate of unattached patients, so patients that are not connected to a primary care provider. So through the establishment of primary care networks, we'll be able to strengthen that with a long-term goal of connecting patients to physicians. We also want to improve patient outcomes through OHTs, through clinical pathways. So right now we are working on integrated care pathways. We're very fortunate that over a year ago, through one of the silver linings of COVID, we have a virtual clinical clinic for congestive heart failure. And now we're currently working on COPD, and that action plan is actually going to be submitted to the ministry next week on December 11th. And also modernizing the delivery of home care. And so we'll be speaking to this in a little bit more detail in subsequent slides, but really wanting to focus on innovation and being creative with how we deliver home care. So building OHTs to last, so really working through the acceleration within the next 3 years is our target areas of focus to ultimately work towards designation under the Connecting Care Act for 2019. That's recently been revised to 2023. And through this, we will create our not-for-profit corporation. We'll establish our primary care network with the support of our primary care providers across the region. And then also selecting an operational support provider to really facilitate the back office supports, everything from finance to HR. So I want to speak to one of our core strategic priorities that the Durham OHT is focused on right now, and that is the Downtown Oshawa Neighborhood Initiative. And this is taking place at 155 King Street, right in Oshawa. And so the Durham OHT is one of 7 projects that has been approved by the ministry to modernize home and community care. And the goal for the Durham OHT leading practice is for service providers to work differently, to work together as one core integrated team that will enhance care delivery through improving the way team members not only work together, how they communicate together, and ultimately how they provide care. So I'm now going to pass it over to Dr. McTavish to highlight some of the work that has been supported within the region from an OHT perspective.
Excuse me. So for the work that's been supporting the OHT from the region, there's been quite a bit, I would say. So all of those signatory partners you saw on the 5th slide, everyone supports in kind, some of us a little more than others just with the ability to do so. So in the health department, it's been split into paramedics and then the public health side. So we have one of our paramedics here. Thanks, Jeff, in case there's questions. So paramedicine's been really important, especially the community paramedicine piece for the strategic priority of the downtown Oshawa neighborhood. They're already involved in that community. They know many of the clients very well. So when this continues to roll out, they're going to continue to be a very important part. So thanks to Jeff for all that work. And then on the public health side, as you probably know, being part of this committee, we have a great health analytics team. So that work with our health neighborhoods, the data in the community really informs a lot of what community partners are doing, and that includes the Ontario Health Team, especially from a health equity lens, because the data is just very rich that they provide. The second bullet is just me. I sit on the executive leadership team, and that means that I support Lisa and the vision of the OHT. And then we also have communications and privacy support. So we have a staff member from communications and then 2 from privacy that do assist the Ontario Health Team with needs as they come up. And recently it's been very busy with communications in the fall, actually. So we've asked corporate communications for some support, and they've done some really great work to help as well. So although it looks very health-centric, it is the region that supports the OHT, but mostly that's just because we've been dealing with health-related things. So this could expand later on to include social services or other groups as well. And then here is a nice picture, and Jeff Jordison is front and center. Thanks, Jeff, for being in this. So this is a health and social care resource fair that happened, I believe, a month and a bit ago. And this was at 155 King Street. And this was a fair for the residents. I understand that the building has approximately 160 residents, and over 100 did attend this fair. So all of these partners were there to provide information about their services. So this opportunity was for residents to say what they needed, what they'd like to see within their building and community, and then services have now been sort of created or supported into the building, things like wound care, diabetic care, and some chronic disease care. So some great stuff happening, and just a fun picture. Apparently it was an excellent day. I was not able to be there. And back to Lisa.
Thanks, Dr. McTavish. And so this slide is really the ecosystem of what the ideal health center and concept will look to as we think of the future of OHT. So this is our future state vision, what we're striving towards, to really be proactive in our response to healthcare instead of responding in that more retroactive crisis situation. So we really want to focus from a population health management perspective where we can build healthy communities and healthy neighborhoods. So we'll pause there. Thank you very much for your time and for the opportunity to present this morning.
And thank you very much. Mayor Foster. Can you?
Thank you. You'd be disappointed if I didn't ask questions. I just have to point the last slide that you had there, the ideal health ecosystem. You know, there was a picture of people camping by a campfire, and that apparently is the new affordable housing that we're seeing across Canada. You were talking to that's not nearly as funny as right? It's actually pretty sad. The primary care network. So I know that the physician recruitment team that is working across Durham Region, I'm hearing chat about essentially creating a new medical school, not necessarily in the way that we are speaking. Are you, or the way that we typically understand, are you involved in that?
So yes, we're involved from a periphery in terms of the new partnership with Queen's University and Lakeridge Health. And this is a really exciting time within the Durham region. The first cohort of med students, 20, were just enrolled this past September for the first inaugural cohort, which is very exciting. And so our goal and our thinking is, how can we keep those 20 within the Durham region? So we're going to train them. We want to make sure that they're incentivized and feel that this is the community that they ultimately want to practice in upon graduation, so we can really help to start to tackle this opportunity in front of us for the unattached patients, and really if we're training that upon graduation that you're wanting to practice and live and reside within this community.
So thank you for your role in that. That is an amazing accomplishment, especially given an amazing accomplishment and in the amount of time that it was brought together. On the downtown Oshawa project, where you're bringing groups together, are you capturing best practices? And I'm asking this question from a purely, self-serving point of view. Clarington has somewhat dodged the issue of unsheltered, not entirely. We know that is only going to get worse. We're struggling, I think, with all of the municipalities in terms of accessing some, I'm going to say simple or at least readily accessible information. Is there any availability of that information or any suggestions you can make to myself and my colleagues?
I'm not sure I understood the question, unfortunately.
Why don't we talk later
there's
instead of...
best practices, they're definitely, that's teed up for sure.
Yeah, I think the question, I think the easy question is, can you help? And maybe it's just a cry for help. if there's a way of pointing us in the right direction of mitigating, because we're not going to solve. But we'll chat, and Commissioner, I know you've agreed to sit with staff as well. So thank you. Madam Chair, thank you.
I'm not sure if Jeff's moving forward to help answer the question, but I think he is.
Jeff, over to you.
Thank you, and it's a pleasure to address this committee. For best practice, we actually have our primary care outreach program, which is the first in the province. So it started in 2018, and other municipalities come to ride out with us to see what we're doing, because we have such a good relationship with the Mission United Medical, and what we're doing is far and above what other municipalities are currently doing. So that is currently the best practice for the province for that type of team.
All right, thank you.
So I would actually encourage, and I had this opportunity, while I didn't get to see everything, and I will be back, Jeff. I spent the day on Sunday with the PCOP team, but I also got to meet with the community paramedics and to see their workload as well. And I want to thank you for that opportunity to firsthand see what is happening. And Dr. Kyle, it was quite the experience, but knowing that the clientele that is being served, it really created an opportunity of comfort and trust. And I saw a lot of trust. And to be able to give that care out to our vulnerable, but also out into our community, and to get on the Monday where they were setting up the appointments to come in for that medical care, otherwise they wouldn't go into the emerge. And I would encourage, if you have time, to go for a ride along and just see what is happening out there, and to see how the staff are relating to those on our streets, those in our shelters, and individuals who, the vulnerable in their own homes, and getting the care. And it's accolades. I think there's so much more that could be done, and the expansion of that program, it should be one that should be further recognized by the province as being the best practice, not only just for the province, but across Canada. I was very impressed. Further? Chair Henry.
Thank you, and great presentation, and for all that our health department does, from paramedics to right up to you, Dr. McTavish and Dr. Kyle. Thank you for what you do. This question's really for Jeff, and I'm sorry, Jeff, to put you on the spot. But yesterday, I had a conversation with the police department on repetitiveness with particular individuals, and the part that they play on the system, and the assets that they eat up. Which includes everything from materials to people.
Yes.
And I don't mean to be negative, but you're dealing with a number of on the outreach program, a number of people that need greater care than what we can provide as a regional government. Do you track the repetitiveness of individuals? And is that data somehow sent to the province to have an understanding that there is a need within our healthcare system for increased support for addictions and mental health and the challenges that come with that, including homelessness?
Yeah, thank you very much for the question, Mr. Chair. So yes, we do track repetitive visits with clients. It's done on our software. That's one of the reasons that the OHT is such a valuable partner, is because it gives us another avenue to filter these clients to CMHA, Lake Ridge Health. So we do, in a way, report it to the province, because we send bulk data to them for our community paramedicine program. I do know through the Minister of Mental Health, Minister Tabolo, he is well aware of the problem in this region and across Ontario. So he has been following our stats fairly closely.
So as other communities adapt to the best practices of Durham Region's paramedic outreach program, is all that information consolidated into a report that goes to the minister?
Not that I'm aware of, no, sir.
So this leads to a bizarre question and a latitude, Chair. If it's not collected, would it be possible for us to collect all of that data as a level of government? if the reports are just going to the province, it shouldn't be too hard to consolidate that in a spreadsheet and then present that to the government as a consolidated information package to try to find ways to put more funds into the challenges that we're having with those problems.
Yeah, yes, sir. I believe that that can be done. It would have to be done with our 911 operations as well, because they struggle with this as well.
So, Madam Chair, I don't want to do it in the form of a motion unless you think it's substantive enough that it needs to be a motion. But the direction would be to work through the system. And it doesn't have to happen overnight. I know this will take time. So that we can take the challenges, in this case, we'll lead by example again, gather the information of the province and make sure that they're aware that the challenges are great and there needs to be adjustments in the system to accommodate the growing challenges of addiction, homelessness, and mental.
I know the chief is on. I'm not sure if he is able, or through Dr. Kyle. Is that something that easily can be just reported back and brought together?
Yeah, Chair, we'll take it back and work it up and report out in the new year.
Appreciated that, then thank you, Chair.
Yeah. And I'm going to call upon Councillor Dice.
Thank you. Thank you for your presentation. With this healthy neighborhood approach, will we be able to also identify the elder abuse issues that are growing, maybe perhaps through the mental health portion of that?
Thank you for the question. I don't want to speak for Lisa, but the OHT as it stands now is still quite new. So this is still like a pilot. Pilot's the wrong word because it's been happening, but it won't come to fruition at least for another year.
Right.
Community paramedicine's already there, so we've hit the ground running, which is great. I think at the end, the OHT should, as per the province, sort of oversee all of that and then look for that data absolutely as part of it. I would say right now, since the OHT is still so small and tiny, it wouldn't fall under that group for the data. Yeah, but certainly an important piece for the community.
I think the data is increasing on the instances of elder abuse, which affects their overall mental health. And it's really difficult to get information on that, so it would be beneficial if we can.
Absolutely.
Thank you.
Noted. Thank you.
And Mayor Foster, do you want to press your button?
Thank you.
You're welcome.
So Chair Henry, I think I know you're going with the request, and please jump in and correct me if I'm wrong. But to the benefit of other folks in the room, recently, Durham Region nonprofit requested a meeting with emergency services, regional staff, and everybody stepped up in a most significant fashion to identify challenges that we had with a very limited number of tenants who, quite frankly, are incapable of living on their own. So I think in one instance, there were 6 calls to Brock's Emergency Services. That is a volunteer fire service. So if you can imagine the volunteers being called 6 times to the same residence in one. The paramedics had the same situation. They know the same individuals that fire services know, that Durham Region Police know. And I think the point is to try to gather, and please jump in, Chair Henry, I don't want to put words in your mouth, but to identify some fundamental problems with a limited number of individuals that are causing tremendous stress on the system. And I mean, I think it's beyond supports available to those individuals. I don't know if filling in the blanks is helpful in terms of what we're looking for out of staff, but I know Mayor Carter would talk to the Durham Region Police. The a limited number of individuals were eating up a huge amount of time. So Chair Henry, is that sort of where we're going with this? And it's nice to hear that Minister Tibollo was paying attention to that. But if we and other municipalities can gather statistics and get the appropriate supports that are required by these individuals, because for some of these, it doesn't matter how much support, they are incapable of living on their own. And how am I doing articulating myself, Chair Henry? I don't always do a great job at that.
The point I was trying to make, and thank you, is that the burdens that are attached to regional government's budgets based on individuals that are repetitive in their challenges is huge. And, I won't speak to the police services, but I do have an idea of the amount of money that it affects them. But there has to be a better way to do this. Continuing to show up at the same address more than once a day, sometimes more than once a week, it takes important services away from the rest of the region. So when a paramedic team or a police officer or a fire department responds to one call, that means they're unavailable to respond to that traffic accident or that other challenge. And for some of these people, it's habitual. It is something that we're managing and doing an awesome job, and I congratulate you, but there has to be a better way to do it. And if we start to collect the data and then we present it to the province in such a way that they understand that the need to invest in different types of care, other than hospitals are important, but sometimes the care is greater than a hospital. My goal is to try to make that happen. So
I'm going to ask the commissioner to speak to this as well, too.
Thank you, Madam Chair. I just wanted to go back to the seniors question, Councillor Dyes. We do have a senior safety advisor program. We work together with DRPS's mental health unit on this. And I can maybe just ask Marusha Lashik, our Director of Family Services, to speak to some of the work that we do there and some of the data if available.
Thank you. We do. We have a social worker who is connected with our DPS, so we have a strong partnership, and we're developing that, and we're sort of evolving that partnership with them. But the social worker does respond to calls that come from the community, concerns that can range from any sort of issues of abuse, financial, physical, neglect, and we are collecting data, we are following trends, and we are doing our best to respond to a growing number of calls that are coming in for this service. So,
Further, Mayor Foster? No? Okay, thank you very much. Mayor Carter? Good morning. Oh, you're on mute.
How am I now?
You're good now. I think Mayor Foster had something to do with that, by the way.
Oh, I see. It's always trying to do that. Can you hear me okay now?
Yes.
Oh, okay, good. Good morning, Madam Chair. Good to be able to see you, the Commissioner, as usual. I'd like to kind of pick up on both what the regional chair and what Mayor Foster had said in regards to individuals that are chronic users of emergency services or are individuals that are unable to make proper healthcare decisions on their behalf. It's amazing. I'm looking at a charter decision that was done in regards to the Kingston aspect. And the curious part about it is it's on both sides of the mouth that are coming out. One is, if we deprive people of medical services such as safe consumption sites, we're directly responsible. On the other side of it is, every individual has the right not to use those services, but the municipality or the service provider is 100% accountable for it. This goes to the question, and I'm going to ask Dr. McTavish that is here. Does Dr. McTavish believe that there's legislative changes that are necessary to be able to make sure that those individuals that are incapable of making proper medical decisions for themselves, that we need legislative changes in regards to addressing the seriousness of the illness that we're seeing, both with the unsheltered, the sheltered population in our province at this time?
Hi, Mayor Carter. Nice to see you online through the chair. I unfortunately can't answer that. I'm not a mental health physician. We're trained in public health, in psychiatry and mental health, but that would be out of my wheelhouse to answer. Thanks.
I appreciate that. And I guess, Madam Chair, I think that this is where I think we've got to wrap our heads around looking at what type of legislative changes are necessary to be able to help the most vulnerable. Because Chair Henry and both Mayor Foster brought up that individuals. Now, I've shared with our Commissioner, Commissioner Stella, and Dr. Kyle that our city has seen over 400 overdoses this year. That is up to the end of November. In many of those circumstances, we're seeing the same individuals several times within days or weeks of each month. And we are unable to actually be able to help these individuals because under the Charter rights, they can refuse medical care. At some point, if we're going to be held responsible, shouldn't we also have the legislative powers that need to be able to help these individuals save their lives? We can do all these programs and wonderful educational programs and outreach programs and have people on the streets, but if we can't get people into the right care, I think all we're doing is we're going through a treadmill of not solving the bigger issues. And I think it's a question that we should undertake in 2024 about what type of legislative changes are necessary if we're going to meet the needs of the most vulnerable in our community. Thank you, Madam Chair, and it's good to see you, by the way.
Thank you, Mayor Carter, and thank you very much. And it's actually interesting. I just read an article of last week, October, 138 deaths of OD on the streets of Vancouver in the month of October. And knowing even with the ride-along on Sunday, just who potentially are frequent flyers, and very concerning. And I'm not sure, Chair Henry, is the potential of us having like a roundtable and to look at what the suggestions are for legislative changes to bring the parties together that have the knowledge and the base to be able to put a statement together and put a proposal forward from the region of Durham? Oh, one moment.
The goal to, once we have the data, would be to invite our partners that submitted the data to a meeting that would also include the appropriate minister from the provincial government to sit in and understand the challenges we're having.
Mm-hmm.
It would be an opportunity to really educate the minister on what's happening at street level. So that would be the ultimate goal. But in order to have that meeting, we need to be able to collect that data.
We need the data, we need the info.
And then once we have the data, we need to invite the partners that submitted the data to that meeting with the minister. So that was the ultimate goal.
Okay, appreciate that. Any further questions? I'm seeing none. Thank you very much, and thank you for all you do and for the presentation today. I'm going to try to see if Alex and Tara are able to work their microphones. Alex and Tara?
Does mine still work?
Alex works. Is Tara there?
Okay. We'll wait for Tara. If not, Cindy will join on her behalf, I think.
Do you want to try your microphone, Cindy? At the bottom of your screen, there's a button that you need to push. Right there. And try.
Good morning. Can you hear me,
Yes,
Madam Chair?
Both of you work. Yeah.
Wonderful. Okay. All right, wonderful. Thank you, and good morning, everyone. Good morning, Madam Chair. We are sorry for the technical issues that we are having this morning. I will be taking Tara Zupanjich's place during this presentation. I did want to share with you, though, that we were excited to have Tara present this morning. She is our new Climate Change and Health Specialist. It is a new role to Durham Region Health Department, so we were excited to provide the opportunity to introduce you to Tara, but we may have to wait perhaps for a future date for that. So I will be here today, and I will be speaking with Alex Swirsky, who is our epidemiologist, and we will be discussing how our climate change and health vulnerability assessment. Today, in this brief presentation, we will provide an overview of our provincial mandate to assess local vulnerability to health impacts from climate change. We will outline the purpose and objectives of our vulnerability assessment, describe our report plan and timing, including our framework for how to assess local health risks to climate change, share key findings from our background primer on climate change and health in Durham Region, and share our new webpage, and lastly, summarize our next steps for this work. Next slide, please. Durham Region Health Department is required to conduct vulnerability assessments as part of our mandate under the Ontario Public Health Standards. Specifically, under the Healthy Environments and Climate Change Guidelines, the assessments should examine health vulnerabilities of rising temperatures, vector-borne illness, food and waterborne illness, and air pollution. In addition to these, based on our evidence reviews, we will which we will review in a few minutes, we have also included the topics of extreme weather, such as storms and flooding, as well as UV radiation exposure. Next slide, please. As we know, climate change is expected to be one of our most challenging public health issues of the 21st century, and health systems will be impacted by climate-driven emergencies. To illustrate this point, we ran a news search on a single day in September, and this is a sample of the headlines that were found. This random single day of headlines illustrates the rapid intensification of climate change. And we are not untouched by it in Durham Region. I am sure you will remember that we experienced extreme heat days and wildfire smoke this summer. So Durham Region is already experiencing the effects of climate change. And yet, based on local surveys, most residents do not believe that they will be harmed by it in their lifetime. This points to a clear need to both understand and communicate the near and long-term health consequences of climate change to help residents prepare as well as prevent harmful outcomes. Next slide, please. The purpose of our vulnerability assessment is to protect and promote the health and well-being of Durham Region residents by characterizing current and future health impacts of climate change in our region. This includes 4 main objectives. The first is to improve understanding of the association between climate change and health. The second is to assess and report on available climate hazard data and evidence that may impact the health of residents now and in the future. The third is to prioritize health equity, and by this we mean getting a much better understanding of people in our community who may be hit worst and first by climate hazards. These are often people who are already experiencing health inequities. The last objective is to establish a baseline for analysis for future monitoring and assessments. It is our hope that these assessments will provide valuable information to decision makers, municipalities, and community organizations and residents to prepare for, respond to, and ideally prevent climate-related health impacts. Next slide, please. Here is a snapshot of our vulnerability assessment plan. We have just completed a background primer, which Alex will review shortly. Then there are 6 planned vulnerability assessments that will be completed one after another over the next 12 months or so. Climate and health is a complex topic that can feel overwhelming. So this is why we have decided to create standalone reports, breaking the assessment into separate reports by climate hazards to help facilitate a better understanding of each hazard, who is most affected, and the unique needs and opportunities for responding to each. Next slide, please. One of the challenges with this work is, what do we mean by climate vulnerability? So we created a framework, but before taking a closer look at the framework, we just wanted to highlight an important point, and that is how we use the term vulnerable. In the context of climate change, we talk about factors of vulnerability as opposed to vulnerable people. And this is a very important distinction. Many climate vulnerabilities are the result of health inequities, often out of people's controls. So they are affected by vulnerabilities, and they themselves aren't inherently vulnerable, and labeling them as such can be stigmatizing and harmful. This was a key message in last year's Chief Public Health Officer of Canada's report on the state of public health. So you will find that in our climate and health work, we never label people as vulnerable. Rather, we refer to factors of vulnerability. Next slide, please. So now I will give a brief overview of our vulnerability framework. The primer provides an extensive explanation, but very briefly, there are 3 main factors of vulnerability that you can see here in the Venn diagram on the right. So as climate hazards increase or intensify, a person's risk depends on their exposure to the climate hazard. So if we use extreme heat as an example, a person living in a densely urbanized area or a person who works outdoors may have greater heat exposure. The second is sensitivity to climate hazards. Some people may be more sensitive to the health impacts of climate change due to factors such as age, genetics, or health status. For example, older adults and people with certain health conditions may be more sensitive to heat due to a decreased ability to regulate this body temperature. And third, the last factor is adaptive capacity. Essentially, what is the ability of the person or the community to protect themselves? For example, when it comes to extreme heat, a person may be older, but because they live with family and have air conditioning, their vulnerability might be quite low. but a healthy person with limited income and substandard housing may experience a higher risk of heat-related illness during an extreme heat wave. So we see that climate vulnerability is influenced by many upstream factors such as housing, income, and healthcare. That is why the framework includes potential intervention pathways A through D on the left. These guide us to consider and assess what interventions are most appropriate for protecting the health of Durham Region residents, particularly those worst affected and least protected. That is why health equity is such an important component, because the health burden of climate change is not distributed equally and should be reflected in both the assessment framework as well as adaptation planning. Now I will hand it over to Alex to give you an overview of the background primer that we have just completed. Next slide, please.
Thanks, Cindy. So as Cindy explained earlier, the primer overview is the first report in our climate change and health vulnerability to serve as a comprehensive background reference document for the topic-specific climate change and health vulnerability assessments by providing a global and local overview of climate change and related health impacts, an equity-focused framework for defining vulnerability, a summary of the approach undertaken to complete the assessments, and local environmental and community features relevant to assessing climate-related health issues.
Alex, you keep cutting out.
Next slide, please.
Oh, we just lost her.
Madam Chair, if it would be helpful.
Unstable. Can you hear me?
Yeah, we can hear you now, Alex.
Oh my goodness.
Okay, go ahead, Alex.
Can you hear me now, or should Cindy take it over?
Yeah, we can hear you now.
Cindy.
Yeah.
No,
Alex, did you want me to jump in?
Cindy, if you wanted to take it over,
Okay.
since apparently.
Sure.
Oh, you can hear me now?
Yep.
I'm sorry.
Yeah.
Yeah, if you turn your camera
I
off as
have
well,
rural
Alex.
internet, as you guys know that is.
She probably lives in Brooklyn.
Madam Chair, would it be all right if I continued with the
Yes,
presentation?
please. Yes, please.
All right, wonderful, thank you. Okay. All right, so the primer here, it provides an overview of the key data through 5 sections or components of the report. So the first chapter is understanding climate change, how our climate system works, what factors cause climate changes, and the impacts of these changes now and in the future. Climate change and health is the second one, and it provides an overview of the vast health impacts of climate change, understanding factors of vulnerability, and the need for an equity-focused approach to protect and promote community health. The third chapter, The Way Forward, is about how health can be integrated into climate risk identification, mitigation, and adaptation strategies, including plans and methodology for Durham Region's climate change and health vulnerability assessment. The next chapter is Durham Setting. So here we explore how Durham Region's rich and varied landscape influences and is affected by climate change. And the final chapter is a portrait of a community, which provides a detailed overview of the unique characteristics and needs of Durham Region's diverse and growing population. And now I'm going to cover a few key findings in each of these sections. In our first report, there were observed changes in our climate system that have been driven by changes in multiple physical climate conditions, many of which have been strongly attributed to human activities, as shown on the figure on the right. A primary driver of climate change is greenhouse gas emissions from human activities, which have contributed to a 1 degree centigrade increase in the average global temperatures, with Canada warming at about twice the global average. Warmings of 1.5 degrees Celsius is considered a tipping point associated with drastic increase in environmental hazards, and risks are increasing with every increment of warming. Although warming of 1.5 degrees Celsius seems small, it influences whether the ecosystem that we depend on for food, water, medicine, and livelihood will remain viable. And there's a rapidly narrowing window of opportunity to enable climate resilient development. Next slide, please. Our second chapter on climate change and health. Climate change is expected to be one of the most challenging public health issues of the 21st century, is already affecting the health of Durham residents. Substantial scientific evidence links climate hazards with illness, injury, and death from severe weather, poor air and water quality, food insecurity and food contamination, vector-borne disease, and ultraviolet radiation. Potential future health impacts from climate change are wide-ranging, affecting individuals, communities, as well as healthcare systems. Health risks from climate hazards are not shared equally. The risk of harm from climate hazards is greater for those already experiencing health inequities. Not everyone has the same ability to protect themselves from harmful climate hazards. Vulnerability is determined by an individual or community's degree of exposure, sensitivity, and capacity to adapt, as mentioned earlier. And the term vulnerable can be stigmatizing. While factors of vulnerability are important for assessing risk, the term vulnerable as a label for individuals, communities, or populations can be harmful. Next slide, please. There is a need to understand local health risks of climate change to Durham residents, and conducting a regional climate change and health vulnerability assessment is an essential step towards preventing, reducing, and addressing climate-related health impacts in Durham region. An equity-focused approach is essential to understand the complex dimensions of vulnerability and addressing the different health impacts of climate change. This focus will let us to prioritize those that are worst affected and least protected. Next slide, please. Most of Durham region is within Ontario's ecologically sensitive and agriculturally productive greenbelt. Land use changes, invasive species, and climate change threaten the ecological functions that the region depends on for clean air, water, a sustainable local food supply, and protection from climate hazards such as flooding, water contamination, and extreme heat. Based on current climate projections, Durham region is expected to experience a warmer, wetter climate in coming years, along with the more variable and extreme weather patterns. Next slide, please. Local demographic data helps to identify priority populations that face greater risks of harm from climate change than others. Priority populations include adults over 65 years of age, children and youth, Indigenous peoples, racialized populations, people with disabilities, people who are pregnant, residents of remote communities, individuals who are socially and economically disadvantaged, and people with pre-existing health challenges. Some highlights of Durham community data relevant to climate-related health risks include Durham region is a vibrant, diverse, and growing community with a population expected to reach 1.3 million by 2051, due mainly to immigration in urbanized areas. Our population is aging, and the population over the age of 65 is growing 4 times faster than the general population. This age group is at greater risk of health impacts from climate hazards. 1 in 5 Durham residents live alone. While social isolation increases a person's risk of harm from climate change, very little data exists to assess this important factor. Recent increases in multi-generational homes may improve social supports and reduce isolation, but this potential benefit is variable and context specific. Disparities in internet access may worsen existing climate-related health risks in remote and rural communities. And as well, more than 1 in 10 residents are experiencing financial hardship, core housing need, or food insecurity. Also, some Durham region residents experience multiple compounded risk factors, for example, older age, food insecurity, and isolation, and there is a need to consider intersectionality when assessing climate vulnerability. In general, Durham region residents enjoy good physical and mental health, but it is clear that health varies by where you live. Awareness of the current and future health risks of climate change is not well established in Durham Region. Although most residents are worried about climate change, particularly for future generations, many think that they will not be personally affected. Next slide, please. We're also happy to share that we have a new website. This is where our vulnerability assessments will be shared as downloadable PDFs with a separate executive summary for each. The webpage will highlight many of our key messages of the assessment findings, as well as provide links to important resources such as subscribing to our heat warning information system and our heat health resources. Next slide, please. Once we finalize the primer report, we will move forward with completing and releasing our vulnerability assessments over the next year or so. The reports will be posted on our website and also disseminated to municipal and community partners. A communication plan will be implemented to help build awareness of the vulnerability assessments and the link between climate change and health, as well as the 6 main climate hazards of concern for our communities. Our hope is that these reports will be widely used by decision makers to better understand the health risks that Durham residents will face in the coming years. It will help to assess what interventions are most appropriate for protecting residents, especially those that are most affected and least protected. Next slide, please. And that concludes our presentation. Thank you very much for your time, and I'd be happy to answer any questions.
Cindy, thank you very much for making the presentation, and to Alex and Tara as well for this work that to pull this all together. Very impressive. Do I have any questions? Seeing none and hearing none, I want to thank you for your presentation, and have a good day. I'm going to move on.
Thank you, Madam Chair.
You're welcome. Moving on through, and we have no delegations. Under health, we have no correspondence or reports. But under social services, we have one correspondence that I pulled, and it's an information report on the planned federal investments for homelessness reaching home allocations. I think it's very important. I have a motion to receive first. Mayor Foster, seconded by Chair Henry. Within the correspondence, if you turn to page 2 of 4, and under the updated allocations and reductions, I think it's very imperative that I was hoping at the next council meeting to make a motion and that we send a letter forward to see such a drastic reduction in our allocations. It's very concerning, and I don't know if the commissioner wants to speak to this as well too.
Through you, Madam Chair. Yes, this was not the expected memo that we were hoping for last week. And this, of course, was received by all of our counterparts who are community entities for the Federal Reaching Home Program. This will impact, our homelessness prevention work, our supports to our various shelters and warming centers and hubs, and much of anything else that that we're doing today. So this is such a critical time, and it is quite surprising to have received this at a time when we've all mentioned the words crisis. So I do look forward to the council meeting and further conversation and the motion that's going to go forward.
Mayor Foster.
Thank you, Madam Chair, and thank you for pulling this. It is so important, and perhaps my layers of cynicism have hardened and developed over time. But I fully expect there will be no response to the letter, that it will go into a black hole somewhere somehow, because I think that is our experience. Chair Henry, you have tried repeatedly, on so many different levels. Is there a way of highlighting this? And you prefer not to be negative, but when you look across the country, we're reading things in national papers about small communities in Eastern Canada that are dealing with the unsheltered. One of the wealthiest nations on the planet, people have to live in tents. And we get this, and quite frankly, most of what I'm hearing about Ottawa is all political grandstanding on both sides. I mean, I'm exceptionally angry, about this. Is there a way of, and I guess it's probably a discussion to have at council, but is there a way of bumping this up? Maybe, looking for some media, because we're getting bits and pieces, right across the nation, and it's unfathomable. And I see Chair Henry has an idea.
Yeah, I'm going to pull Chair Henry.
Madam Chair, may I suggest that we alter the rules of committee to introduce your motion, that you step away from the chair, have the vice chair take control of the meeting, introduce the meeting, council, committee will endorse this unanimously, I'm assuming. It will go to council where you can pull it. I would ask that you direct it to AMO and FCM, that the MPPs, our local MPPs and MPs, the MP for Ajax is the Minister of Health, and that it be that we can have a good discussion. But I think it's important that it comes from this committee and has full support. So.
So inscribing the motion, I hadn't prepared the motion for today as yet, but we can. Look at this. Look, just like that.
So
your wish is my command.
So I think part of this is to introduce a motion in committee, we have to waive the rules. Okay.
Yes.
So, Madam Chair, if you would allow me, I will give you a motion to waive the rules to introduce a motion.
Second by Councillor Anderson. Any opposed?
And then.
Seeing none?
And then I'd like you to make the motion.
Okay, I would be happy to move the motion, but I'm going to ask for Vice Chair Joanne Dice to take the chair at this point in time. Do you want to just do it from there, or actually you have to control it from here, so I'll jump over there. Can we just put it up on the screen?
Can you send it to? Yeah, we're going to. Wherever it is. Since it's not my. Okay. Just give me 1 second, right? Thank you. Councillor Roy, did you want to read the motion?
I would be happy to read the motion, and my seconder is Chair Henry. Whereas Durham Region, like other municipalities across Canada, is experiencing a homelessness crisis, with homelessness in Durham increasing by 67% from 2022. Whereas the needs of unsheltered residents continue to outpace available supports. Whereas Durham Region received notice that its funding allocation under the federal Reaching Home is decreasing by approximately 80% by 2027 to 2028. Whereas Region Home funding supports local agencies experiencing increasing demands and pressures, including those delivering housing stability programs, respite beds, and other emergency shelter operations. Whereas the Reaching Home funding reduction will impact our community's most vulnerable residents. Now therefore be it resolved, the chair write a letter on behalf of council to the Minister of Housing, Infrastructure and Communities, requesting an urgent revision to the Durham Region's Reaching Home allocation to ensure that a minimum there is no reduction to the period of 2024 to 2025 to 2027 to 2028 from the $4,956,923 funding amount committed in 2023 to 2024. Staff be directed to include a request that Reaching Home be scaled up and made a permanent program, be included in all federal 2024 budget consultation materials. A copy of this motion and supporting letter be circulated to the Prime Minister, Federal Minister of Finance, the Federation of Canadian Municipalities. I'm going to also add, if we can add AMO and OMSA on that as well too, and the local area municipalities in the Durham region.
Are there any questions or comments on the motion?
If I could just speak to the motion as well, too. And I think it's very self-explanatory, but we have already declared from the region that there is a crisis within homelessness within our community, and not just our community, but across the province and across our country. And to see such a reduction and to be impacted where we're trying to be partners around the table to ensure that we can support our most vulnerable. It's been stated that the money comes from the feds, province puts in the policies, and we're the ones who are responsibility for implementing what needs to happen. And when we're being restricted by not having the financial supports, this is an area that we have to be more cognizant of, and that the federal government needs to step up and be a partner here. And it's very discouraging that the funding distribution is being taken away. We're trying to be partners around this table to be part of the solution.
Are there any other comments or questions on the motion, Chair Henry?
Thank you, Vice Chair. I would suggest also adding Marco, but I think in this motion, we need to write the leaders of the oppositional parties in Ottawa. The challenge with homelessness, so my rant for the day, but I've been on holidays, so it'll be a soft rant, is that Mayor Roy is absolutely right. We are the boots on the ground, and we manage all of this. The challenge is we don't make the laws of this country, and the repetitiveness, especially of the criminal element that sells poison to our residents, who forces them, and it's a big part of homeless addictions and mental health, are treated like victims, and the people that are living on the streets are treated like criminals. And that is wrong. And to take the funding away from the boots on the ground that manages this is, well, there are some words I'd like to use, but I'm not allowed to use them in the council chamber. It is so wrong. And we are doing more with less every day. And while we do so many great things, without a change within the way the laws of this country work, we are not going to be able to fix this. And to remove the funding from what we're trying to do is unimaginable. You know, I am prepared to do whatever council directs me to do, and including being loud and what we can. But this isn't just a Durham Region problem. This is going to affect, and we're lucky. As communities go, Durham is in a better financial picture than most. But with all the pressures that have been put onto this region, our best practices in financial management are being eroded every day. And that takes away from doing other things. So it is a great motion. I support it, and I'm happy that it was so well written and prepared for this meeting.
So, Mayor Roy, do you take that as a friendly addition to your motion? Thank you. Mayor Carter, you're next. You have a question?
First of all, thank you very much, Madam Chair. I hope you can hear me.
Yes.
Okay, good. I appreciate the motion, and I appreciate the direction it's going in. Just a question through you to our regional chair. A letter of September 1st that was written by our regional chair to the Right Honorable Justin Trudeau, the Honorable Pierre Peliev, and Mr. Jagmeet Singh was submitted on behalf of this council and the region of Durham in regards to homelessness. Has the regional chair had any response in regards to those three leaders?
Chair Henry?
So again, Mayor Carter, great question. The quick answer is no. I have had members of two of the parties have contacted the region, but not the leaders. I do want to say that the Prime Minister was in Ajax last week. We didn't know about it. He was there with the Minister of Health. It would have been loved. We would have loved to have had a quick coffee or even a 10-minute conversation about the challenges that Durham is having, but really Durham is a microcosm of this entire country. So the quick answer to your question is no.
Thank you very much, Mr. Chairman. It's good to see you, by the way, and welcome home. Um, this is where I'm struggling with this particular motion. I think there's a couple things. We are being challenged, communities across the country right now, in regards to charter challenges, in regards to human rights. And based upon what the government is doing, I believe that, and we would need a legal opinion in regards to it, is they are basically are restricting our hands in regards to addressing the issues and holding us accountable on the charter rights, but also depriving us of the appropriate funding and plan to be able to address the most serious issue this country has faced. So that's number one. So I think there's two things there. One is I'd like to get a legal opinion based upon the challenges of the charter and what our legal position is, and am I interpreting it correct? Because I think that's an important aspect. And the second thing I would say is writing letters is fine, but I believe that the chairman, along with the 8 mayors and as many members of council, are available to hold a press conference and talk about exactly what's being proposed by the federal government. And if that means that we do a press conference every 3 weeks in regards to this issue and continue to be able to say that we still have not heard from the party leaders, this is what the federal government is doing. And based upon their inactions or their disconnection in regards to the seriousness of this matter, we will continue to hold these press conferences to be able to highlight this issue. We have tried to play nice in the sandbox. We've tried to communicate. We've tried to utilize the resources that are available to us as not only a committee, but also as a council. And we still have not heard from the leaders and the people that want to be prime minister of this country in regards to the number one issue that our nation is facing. So I think that we have to be a lot more aggressive in regards to our actions, and I would ask that committee take that under consideration. But writing letters is one thing, but we've got to do something different in regards to bringing the awareness of this. You can't suck and blow at the same time. You can't say you've got to fix it, and by the way, you have to abide by the charter, and then not give us the resources to be able to actually be able to address the charter concerns. So the federal government plays a significant role in regards to us addressing this issue. The Prime Minister, Mr. Poilievre, and Mr. Singh have shown no interest at all in regards to having a conversation with our regional chair or our region at all. And it's about time that we go full court press and say enough is enough. I'm just, I'm tired of them standing up there and saying we care. And by the way, you got to abide by the charter. Oh, by the way, we're not going to give you the resources to resolve this issue. So enough is enough. So that's my suggestion. I would ask our legal department to look in regards to them funding us and how that ties our hands in regards to living up to the obligation under the charter. Number two is I think that we should write the letters, yes, but I also think on the other side is we need to have a press conference on a regular basis to say, by the way, still haven't heard from them, and my phone, here's the 1-800 number, Mr. Prime Minister, give me a call.
Thank you, Mayor Carter. Mayor Foster, you're next.
Yeah, I'm hesitant to follow Mayor Carter. I agree 100%. So one, following on Mayor Carter's comments, will staff please take it upon themselves to arrange the press conferences, and not just on this issue. Mayor Carter is 100% correct that we have been playing nice for a very long time, but there are a number of issues that I think I was taken. Mayor Carter was asking if I used the word behooves. Let me use that word again because he liked it. But we need to start being more aggressive and speaking up on the things that are impacting our community so deeply, such as this, and maybe stop being so polite. Would it be horribly impolite to suggest in the letter that we expect a response within X number of weeks and months, and to suggest in the letter that staff will be bringing a public report for public debate to council on the results of that So I'll leave that out there, that we expect a response, and the public will know in a public document if we got one or not. And I wonder if, more broadly speaking, if staff can provide regular reports on how many requests we make of senior levels of government and how many of those are unanswered. We need to start holding them accountable. Thank you.
Thank you. So I believe the Commissioner of Social Services would like to speak to this.
Yes, thank you, through you, Madam Chair. We can prepare a plan to bring back to Health and Social Services in January, a sort of a communications government relations strategy on this topic, if that works for this committee. That way we just get better organized and
Madam Chair, if I may suggest it's broader than thank you, but
Councillor Foster, so everyone can hear.
I figured it would take long before it came on.
We're not as quick.
But I wonder if it's broader than Health and Social Services if you engage the regional communications team, because this is so important, this topic, but there are a number of topics, and Mayor Carter's 100% correct. If playing nice isn't getting you anywhere, maybe we need to change tactics. So thank you.
Are there any other comments or questions? So we have then a motion, well, I don't know if we put it in a motion, but we have a referral here for staff to look into how we deal with the public relations strategy. Is everybody in agreement with that? Okay, thank you. Are there any? Yes, Mayor Henry.
Sorry,
It's okay.
This motion will be referred to council for council's endorsement, correct?
That is correct.
Perfect, thank you.
Are there any other comments? I just have one about this issue, and listening recently to the news where we've had layoffs at CBC of 1,000 people, and there are other organizations with massive layoffs, which means potential for more homeless, and how, you know, we never talk about the connection. We understand to some degree the connection with the financial stability of communities. When we have more stability, when more people are working and bringing in an income and are spending money to help with recessions. So I really can't understand why the decrease in funding to support this, to support getting people back on their feet and back to work, it doesn't make any sense, because it just makes the situation worse throughout the country, not just here in Durham region. So I do support this motion. Recorded vote. And that's carried unanimously. Thank you. Thank you. Chair Roy? I scribbled on your paper. Sorry.
Thank you very much. And we're moving to reports, 8.2A. I need a mover. This is on the capital projects related. Chair Henry, second by, we already dealt with B. Yep. Any questions? Not seeing any online or here. Any opposed? And moving forward, our next is there any other business? Merry Christmas, Happy Hanukkah, and thank you, everyone. I know we'll see each other at next regional council meeting, but motion to adjourn. Mayor Foster, Councillor Dyes, any opposed? Thank you.